One of the best things that we can do to keep ourselves physically active is to get started and to realize that it is and can be very enjoyable, and it also can be sort of habit forming in a good way. You just know you feel better, and you start looking forward to that 15-minute jaunt with the dog between meetings. Or, now that the days are longer, we have a chance to get out after work and really take care of some of those chores in the yard that, maybe we decide we can rake by hand and actually get some physical activity that way.
Being physically active is one of the most important actions we can take to improve our health. The Physical Activity Guidelines for Americans includes recommendations for children, adults, and older adults to help foster normal growth and development and make people feel better, function better, sleep better, and reduce the risk of a large number of chronic diseases. On today's Sound Living, combining physical activity and healthy eating to improve our overall well-being. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. The Physical Activity Guidelines for Americans encourage preschool-aged children, those ages 3 through 5, to be physically active throughout the day to enhance growth and development. Children and adolescents, ages 6 through 17, should do 60 minutes or more of moderate to vigorous physical activity daily. Adults should do at least 150 to 300 minutes of moderate intensity activity or 75 to 150 minutes a week of vigorous intensity aerobic physical activity or an equivalent combination. The guidelines for adults also apply to older adults. In addition, they're encouraged to incorporate balance training as well as aerobic and muscle strengthening exercises into their weekly physical activity. K-State Research and Extension Nutrition Specialist Sandy Procter says the benefits of physical activity and eating healthfully are hard to ignore. Sandy, it seems as though spring not only brings us out of that winter hibernation, but this year it's also bringing us out of the COVID-19 hibernation, and physical activity is something that we are encouraged to do. There are even guidelines that tell us really what we should be doing.
Jeff, it's one of the most important things I think we can do to invest in our own personal health and in the health of those that we love, to encourage physical activity, to make room for it in our lives, and to build it in so that it becomes as automatic and as repeated as we possibly can.
We've talked a lot in the past about the dietary guidelines, and you were mentioning to me the fact that really the physical activity guidelines are kind of parallel to the dietary guidelines.
They really are. There's a lot of parallels. The most recent edition of the Physical Activity Guidelines came out in 2018, and that was after the previous set had come out 10 years earlier in 2008. So there were lots of updates and lots of revised guidance. And again, just like the dietary guidelines, all built on the most current research, the most cutting-edge science information that we have about physical activity and its effect on our health.
They're really looking at minutes of activity. Is that kind of how these break out?
Right. It's a prescription, really, if you think about it, that where the science shows, just like we talk about servings of fruits and vegetables make half your plate fruits and vegetables through the day, science has shown and research studies have upheld the idea that adults need at least 150 minutes of moderate intensity aerobic activity, meaning where we're moving and actually taking in oxygen that gets your heart beating faster. So 30 minutes a day for at least 5 days a week. In addition to that, they encourage for adults at least 2 days focused on strength training exercises. And so activities that make your muscles work harder than usual.
The interesting thing is this is important for not only kids who are relatively active, maybe not as active as they used to be, but still probably more active than adults. And it kind of breaks it out in the fact that no matter what you're doing, it's going to count, like you say, if you can get it at least up to that moderate intensity level.
That's right. And that was really one of the changes from the 2008 set to this 2018 set of guidance is they used to say, any exercise that you do, as long as you do it for 10 minutes at a time, counted. They've even stepped away from that and said that really it's like a bank account. Any deposit you make for the good is going to be there and do good for you. So it doesn't have to be 10 minutes at a time. If you can put in physical activity during a television commercial, or, and this one rings true to me, between Zoom calls, you can really add to your total every day and meet those minimums that are required in a way that doesn't necessarily say, I don't have time to exercise. I don't have time to add that to my already busy schedule.
Is that part of the problem we run into, is that we just don't make the time for this physical activity? Because we know that there is an obesity problem in the U.S., and this has to be part of the reason.
I think it is part of it, is thinking that it's an extra set of requirements. And I also think, one of the best things that we can do to keep ourselves physically active is to get started and to realize that it is and can be very enjoyable, and it also can be sort of habit forming in a good way. You just know you feel better, and you start looking forward to that 15-minute jaunt with the dog between meetings or whatever it is that our lifestyle allows these days. Or, now that the days are longer, we have a chance to get out after work and really take care of some of those chores in the yard that, maybe we decide we can rake by hand and actually get some physical activity that way.
You mentioned the fact that once you start doing it, it becomes a habit. And I think we also encourage people to start slowly so that they don't burn out.
That's true. It isn't something that you're going to mentally adjust to overnight. And physically, it may take some adjustment too. I've seen urgings for people to just take a small walk, just take a few extra steps if it's a challenge for you. And to be sure, if it's something that you have existing health conditions, to be sure to talk it over with your healthcare provider. But almost all of us would benefit in so many ways from increasing our physical activity. Not only do we have a mental improvement most of the time just from moving more, getting blood circulating, but we may find that it helps us stretch better, that we are able to be more flexible, doing things that maybe were harder for us once we start increasing and mindfully adding some physical activity to each day.
Well, and I think we also hear about the impact that this can have on chronic disease prevention as well.
It's huge. It's one of the biggest things that we can do, in addition to eating healthfully, to prevent the onset of some of the most, what I would say, consuming chronic diseases that are plaguing not only our country, but the entire globe. And that includes preventing extra weight and obesity, keeping circulation improved, so preventing heart disease and all sorts of chronic diseases that we know may have a start in sedentary behavior.
And I think if you are pre-diabetic or type 2 diabetes, just a small weight change can make a huge difference.
That's true. It takes usually just a small amount of weight loss, 5 to 7% can make a big difference in pre-diabetes. And the best way, studies show, to do that is not through just limiting calories or changing your diet, or not just exercising, but a healthy combination of the two. Increasing physical activity, checking portions, and choosing more healthful food choices whenever possible. And those techniques built together can really make that slow but lasting weight change.
I mentioned that we're kind of coming out of hibernation right now, and this is a great time from an exercise standpoint because we are able to get outside, but it's also an excellent time because there are so many fresh fruits and vegetables now becoming available at a really good cost as well.
They're available. There's the activity of going to local farmers markets and checking out available local foods that might be there. It's also a season for grilling, and that's a very healthy way to prepare fruits and vegetables, lean meats, in a preparation method that's very helpful too. So I think there's just lots of aspects about it, and probably we would be remiss if we didn't mention it's time for Walk Kansas. It's time to get out, start dusting off those sneakers if they've had the winter off, enjoy the spring air, to get some additional steps and really start purposely looking at how to increase the physical activity that we undertake each day.
You talked about this becoming a habit, and that's one of the reasons why Walk Kansas is an 8-week program, because you get used to doing the walking, you get used to eating more fruits and vegetables and drinking more water, too.
And those are such good habits. We sometimes think about habits as always bad habits, but we can develop and encourage and strengthen good habits as well. And that combination that you just mentioned, that goes a long way. The physical activity, the more fruits and vegetables, more water, and the socialization that comes with getting active with other people or having someone that helps keep you accountable to get that daily physical activity. That kind of socialization is also really helpful and healthful to prevent some of those negative effects that we get from isolation as well as from just plain sitting too much.
I was surprised to find out that when I did be physically active, I assumed that I would be hungrier when I was physically active just because I was burning calories and things, but I've actually found out it's kind of the opposite. I tend to not be as hungry when I'm exercising the way I should.
You know, I have experienced that myself. I used to make a point every noon to go over before eating lunch and work out in the pool here on campus, and would find that I was very hungry going in and could, barely think about getting through the exercise in order to eat lunch. But noticed by the end that my hunger had actually abated without eating, and that I was a little bit more in control then of how much I chose to eat for lunch. And I think it's that way with any type of physical activity. It sort of reprograms your thought process, and it also allows you to tune in a little bit more closely to what those actual sensations are. We know so often with hunger that it's more than physically being hungry. It's the clock says so, or we're bored, or we're programmed to eat at that time. And so having some of those diversions to that kind of mindless process of, it's time to eat, but actually tuning back in to what our body is telling us can be super helpful.
I know that we always try to not overwhelm people in terms of trying to take on too much at once, but this is probably something that could be done in conjunction with one another, increasing your physical activity and maybe reducing or learning to eat a little bit more healthfully.
Well, I think they kind of work together. If you're going to make the effort to make some changes, like you said, it's probably not smart to undertake everything all at once. A minor change or two together and give those a try until they become a little bit more habitual, a little bit more routine for you, is probably a really good place to start. So maybe, like you said, just the things that we focus on in Walk Kansas, the increased daily activity and increasing fruits and vegetables. We know if we just have those two factors, we can make a huge difference in our health. And if you want to add in a third one that might be relatively easy to accomplish, think about making sure that you get enough good quality sleep. I always think, for me, making sure I get enough sleep is sort of a gift. It's like, yes, if I can just make myself stop and clear my mind and go to sleep, that's really something that research shows is extremely positive for our health and a lot easier for most of us to accomplish than maybe some of the other steps that we know we should take.
We mentioned some of the federal resources that are available, but Extension also has not only publications, but they also have some programs in communities that people can participate in from the physical activity side of it and also the health side of it.
Right. In addition to Walk Kansas and the Walk Kansas for Kids programs that are out there, there's the Stay Strong, Stay Healthy programs that increase physical activity with seniors, and that one involves a lot of the strength exercises that are really needed throughout the life cycle, but we particularly need them as we age to keep those capabilities and self-care abilities as strong as they can be. And many of our SNAP Ed programs, in addition to having nutrition education, will have a real emphasis on physical activity too. And the same with FNET programs across the state, because we know the positive effects of eating healthfully are only magnified when we take time and focus to increase or to make sure that we get enough physical activity each day as well.
That's K-State Research and Extension Nutrition Specialist Sandy Procter. To learn more about health and nutrition programs offered by Extension, contact your local Extension office or visit ksre.ksu.edu. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.